I was assigned to go to New Bedford, Massachusetts, as part of a nationwide effort to understand why so many children were not enrolled in school. And how did we know that? Because we had census figures of how many children there were in a community between the ages of 5 and 18, and we had school enrollment figures, and they didn't match. Where were the missing children? Knocking on those doors was an eye-opening and heartbreaking experience. I found children who weren't in school because of physical disabilities like blindness and deafness. On a small back porch off her family's home, I met a girl in a wheelchair who told me how much she wanted to go to school. But she knew she couldn't go simply because she couldn't walk. These children were kept home because the schools couldn't and wouldn't accommodate them. They wanted to learn, they wanted to succeed, but they never had the chance. I knew then that I wanted to spend my life fighting to be a voice for children who were left out and left behind. I wanted to give them the same opportunities I had growing up. The Children's Defense Fund submitted our results to the Congress, and with the help of strong leaders like Senator Kennedy and all of you who were advocates, it led to the Individuals with Disabilities Education Act. Mandating that children with physical, emotional, and learning disabilities be educated in the public school system. My work on this issue came full circle when, as a senator, I helped to write the IDEA Reauthorization Act in 2004 to ensure that we had targeted resources dedicated to teacher training. In the Senate, I have also worked to pass the Community Choice Act, which will finally we hope, eliminate the institutional bias in our Medicare and Medicaid systems. I've aggressively fought to investigate the linkages between environmental toxins and disabilities. And I have strongly supported the ADA Restoration Act, and I look forward to signing it when I'm president, and you're all invited to the signing ceremony. When I am president, my White House will welcome you. Our government will be a partner with you, and new opportunities will be open to you. I have laid out an agenda to increase employment among people with disabilities. These reforms are long overdue. Americans with disabilities have half the employment rate and double the poverty rate of those without disabilities. Even those who have graduated from college work at only 2/3 the rate of others. We need to provide more opportunities for people with disabilities to break into the middle class, not just to survive, but to thrive. One of my first acts will be to reinstate my husband's executive order that committed the federal government to hiring 100,000 people with disabilities. President Bush was wrong to abandon that commitment, and I'm going to get us back on track. I will also double our investment in work-enabling technologies by providing more low-interest loans for purchasing them. I'll provide real-time support for employers so they can make the accommodations necessary for their employees to do their jobs. I want to also propose and work to pass a $1,000 per worker tax credit to offset the expenses of work and transportation for workers with disabilities. But in addition to the positive agenda that I will pursue, I want to get rid of the disincentives for work in so many federal programs. Right now, people with disabilities can lose their Social Security disability insurance, their supplemental security income, their Medicare and Medicaid benefits when they earn even a tiny salary. That is absolutely upside down and backwards. I mean, just think about it. It makes no sense. Even if you can work and want to work, there's a penalty if you try to work. I mean, we are a nation that believes in work, and we want people to make a contribution. We believe it's in the individual's interest as well as our country's. That's bad for taxpayers. It's unfair to people with disabilities, and we need to end it once and for all. One of the proudest accomplishments of the Clinton administration was to sign the Ticket to Work and the Work Incentives Improvement Act into law. As a result, 31 states have enacted policies to reduce the disincentives to work. That's significant progress, but state policies are still uneven. That's why we need to move at the federal level. As president, I'll help working individuals with disabilities buy in to Medicaid, eliminate the Medicare eligibility time limit on the number of years an individual can work, and conduct a review to determine where disincentives to work still exist in federal benefit programs and where we can and must do better. I think we can break down these barriers to employment and empower people with disabilities to find the jobs and careers that are fulfilling and important for them and the rest of us. Finally, I want to mention my health care plan. It's called the American Health Choices Plan, and it has real significance for people with disabilities. My health care plan will let you keep your existing coverage if you are satisfied with it, but it provides affordable choices if you don't have coverage or you are dissatisfied. And it covers every single American. Everyone will have access to the same choices members of Congress have now. We have a congressional plan that covers members of Congress and federal employees. It works pretty well, and you pay for it. It provides more than 250 options, and it has a lower cost than you'll find through most employers and certainly on your own in the marketplace. I believe if it's good enough for members of Congress, it's good enough for you and every other American. Under my plan, you will never be denied coverage because of pre-existing conditions or risk factors. Right now, health insurance companies in America spend $50 billion a year trying to figure out how not to cover people. I mean, that's their business model. They claim they're in the health insurance business, but they're really in the health no insurance business. They're trying to avoid covering people, and then if they somehow get caught and they actually cover you, they try to avoid paying for the services that you've received. I think that's wrong, and I'm offering a new business plan. In fact, I'm going to save them a fortune. Because here's the new policy. No more discrimination, period. Cover everybody, cover pre-existing conditions, no questions asked. My plan requires insurance companies to compete based on cost and quality, not how skillfully they can exclude patients with the greatest medical needs. We're also going to start covering prevention. I believe we can actually avoid some disabilities if we provide prevention. The clearest example of that is the government and health insurance plans rarely pay for a visit to a podiatrist for a diabetic, but they pay for the amputation of the foot. Therefore, we have created a disability instead of preventing a disability. And there are many other examples that one can go through in the absolutely backwards way that the healthcare system currently operates.